Hi everyone, welcome to Center of Balance Live. I'm Phua from Center of Balance, the acupuncturist. Now, today's topic is about acupressure point for female infertility. Acupressure point for female infertility. Right. So we're gonna talk about acupressure point for infertility, which means you can do it at home. Your patient can do it at home if you're a practitioner in here. Okay. So what do? We do this. Moxibustion in here. So acupressure point, you can apply different thing on it. It can be moxibustion stick. It can be oops, God, sorry. Let me make sure this got plugged into my computer. Right. Okay. So hi everyone. Hi Eric. Hi Happy Day, and Veronica. Good morning. I'm good, thank you. I'm going. I'm good. So today's topic, we're going to talk about acupressure point for infertility. Female infertility. When it comes to female infertility, you may find a lot of female, they suffer from fertility and they have a common symptom, cold. What? Extremely cold, cold in here and here. Hands and legs and toes and foot, cold. But they may feel hot flushing on the face. They may feel feeling hot all the time or thirsty all the time. But often hands are cold. They are few, not a lot, few that get warm hand and warm feet. Not a lot. Okay, and that's different situation. So most of them get cold and most of them get period pain. As I say, there's when female come for infertility and you ask them about period and they have PMS, and just about most of them think about PMS normal. You know why they think about PMS normal? Because most people get it. Most people suffer from it. It's common to get PMS, to get cramp, lower back pain while you have a period, while you're bleeding or before that. So it's very common, and it makes people think that's normal. Oh, it's normal. My mom get it. Oh, it's normal. My sister get it. Oh, it's normal. All my friends got it. Everyone get the same symptom doesn't mean everyone, all of you are in the group in the same group, and that group called normal group. That group actually called abnormal group. Does it make sense to you? I always ask my patient this way. Well, are you telling me that your experience of the pain and cramp while your period or before your period is normal because everyone get it, and in your family, every single one in your family get it, and your friend all get it, all suffer from this symptom, and you're telling that me it normal. But there are some people that when they have their period, they don't feel anything. They don't have cramp, no PMS before or during period. Are you telling me that those people are abnormal and you guys suffer from it? You are normal, right? And then they, most of the time, they don't know how to answer it. If I ask this question, they don't know how. I said, well, just because you suffer from it, just because all of you abnormal, too many people suffer from it, it doesn't make you normal. It's an abnormal symptom, abnormal condition while you get your period and you suffering all this symptom, right? You if you come up with any patient talking about period pain, they will say that's normal. I've got it. My grandma got it. Doesn't make sense. So you need to explain to them, let them understand why it's abnormal, right? So then you take the chance to explain to them the organs theory according to Chinese medicine. This is how I do it, right? Right? Then let's keep focus on our acupressure point. Now the acupressure point. Now it means as an acupuncturist, if you're an acupuncturist, you can show your patient something to do at home. And some patients really ask me, what can they do at home um, uh, for infertility treatment? Yes, there are a lot of things that you can do at home. Okay, so acupressure point is one of the things. Acupressure is one of the things. So I recommend for everyone. It doesn't need to a doctor things like that to tell you how to do it. And when you watch this video, you can do it yourself. Okay, the simple point for you is on a kneecap, right? On a kneecap, then you have triangle and a kneecap. This triangle for the on the inside of the ankle, right? So about 4 fingers from here above, right? So this is the outside, this is stomach area, and when you do it inside is the shear high point. The 4 finger, and get the most sensitive one, and press it and rub it for 1 to 2 minutes. One side will do. You can alternate it. Okay, 1 or 2 minutes. Okay. Normally, I ask them if they a lot of point. I ask them to do 1 minute daily, with all the point all together. Okay. So 1 minute in here, right? And this point you can do acupressure point. And Chu San Li is over here, lower down here. I'm going to show you where the point is, which point that you can do acupressure point. Chu San Li, all right. So it's on the knee, under the kneecap, and there's a hollow in here, and about 4 finger below the hollow, and that is about Chu San Li, stomach 36. And get your finger down there and rub on it. The second point. And third point, it's here. 3 fingers on this level. It can be up here, can be in the middle, can be in here. And up one level, 1, 2, 3. And 3 finger in here, right? And lower one level. Okay, on this area, you get nasty point. If they get 1 sensitive point, you work on 1. You get 2 sensitive point, you get work on 2. Just use a knuckle. You can use a knuckle. You can use massage device to press it. Because you can get your fingers to press on it. But if they become a lot of point, I suggest you do your knuckle, because if you use your hand, you may get hurt in your joint. Okay, just like this. Simple. First detect the point. Like, oh, I've got quite sensitive in here. It's not actually on the middle, it's actually on the side. Okay, does it make sense to you? All right. Another one is, this is pericardium 6, stomach 36, right? And liver last position 4. So with that one, you do this, matching with this. You see? So match this crease with this crease, match it together, and put it like this. Now, if you do this, you may feel it, but even strong one, put your 4 finger holding your hand like this, and press it like this. And especially you do it to the bone, metacarpal bone, and you feel more sensitive. At this point, I always suggest my patient go from here down to here, from here down to here. Okay. At this point, I suggest my patient to do it before ovulation, not after ovulation. Why is that? Because if you may pregnant already, this point will lead or push the baby out. So it may lead to miscarriage. So particularly when you ask a patient to do that, oh, and you're watching this video, you do it before ovulation or while you have a period. Okay. Now before ovulation is much safer. After ovulation, we don't suggest you to do it. Okay. And by razor it's fine. And what else? Over here, 4 fingers above the uh, ankle bone. Okay, 4 fingers above the ankle bone. Uh, Over here, and then right after the shin bone, and you go palpitate and get the most sensitive one and work on it about 1 minute. Okay, this is spleen 6, sun in gel. Okay, so there are a lot of points: 1, 2, 3, 4, 5. 5 points already. And here again, this point do before period. I know, before ovulation, not afterward. Okay, so those are the points that everyone can do. It's suited for any cases of infertility situations. Okay, you may find it while we use spleen 6, level 4, and stomach 36. Why do we use those? This can done for any kind of disease because according to balance method acupuncture, those 3 points can cover all organ function. That is why I make it into a home program video called 321 acupressure program. And with our 321 acupressure program, every of my patients get a video to show them how to do acupressure point as well as how to breathe properly. Breathing, abdominal breathing. Why breathe is so important? As I said, if you have the theory of health, if you know how to keep yourself well, if you know the theory, then you have the method. If you don't have the theory, you don't have the principle, you don't know how to treat, how to keep you well. My principle and theory are that with gold without blood, you can't heal. And what is in the blood that help you heal? Nutrient and oxygen. And oxygen, when it comes to oxygen, you want to get your lung function to better, and you want to practice your breathing because most people breathe through just chest, you know. And you need to use your abdominal to breathe. You need to practice it. That's why we put on video in 3, 2, 1. And what one is abdominal breathing. Two was two legs exercise. You don't you tell me that I walk a lot every day at work. It doesn't count. It doesn't count. Exercise, you have to do just exercise. Okay, you need to take the time for it, and then acupressure. So in this program, it helped a lot of people get better and for the maintenance as well. Then on top of 3 points for general health, then we put on spleen 6, 血海, right? Spleen 6 and 血海. So those 2 points. Then let me show you how to do moxie bashing. So without acupressure point, like this point you can't do acupressure point, right? And this point we do after ovulation. You don't do it, right? You don't do acupressure point for it, right? You do moxie bashing. So moxie bashing, the first point I will introduce in here, below belly button. It can be 2.5 fingers or 3 fingers to 5 fingers. Okay, 5 fingers Guan Yuan, and 5 fingers below here, below belly button. So about 5 fingers from belly button down there, approximately, right? Okay, so that's Guan Yuan, and between Guan Yuan and belly button halfway there's Qi Hai. So those 2 points. So I normally just use Guan Yuan or Qi Hai or both. Okay, Guan Yuan is the first choice, and so like the moxie bashing, I use smokeless moxie bashing in general, and this is causing a lot of smoke, and it smells like marijuana, but it's not. It's called moxa. Okay, So light it, and then you get a patient, put in tummy, and locate the point, and doing this clockwise. And you feel the heat, you can take it out a little bit, adjust a certain level, how close to the tummy, and keep in there and keep moving it. Or for blood circulation in here, for energy, for warming. Okay, hand and feet will get warmer and warmer. Okay, just do this. Then, and when it's getting hot, you can up and down, or go sideways. When it's not too hot now, and because when you stay in one point, it get hotter and hotter. And when it get hotter, you take it out a little bit. So don't put it closer to your tummy that close. Okay, lift it up and keep doing it. Okay, this point 1 or 2 minutes. It can be 3 to 5 minutes if you wanted to, if you have time. At this point is very important. Then the rest of it, the shear height, is good for 1 minute. Sun in gel is good for another minute, and Jusan is another minute. Then Negon another minute, and Hergu another minute. Again, Hergu, I don't suggest you to do it after ovulation, even moxibustion. But moxibustion on Sun gel is no problem, even after ovulation. Okay, why is that? Because Sun gel is nourishing the blood rather than the qi. And Hergu, between Hergu and Sun gel, one is qi point, one is blood point. When it comes to female fertility, you want to increase blood and not increasing the amount of qi. Okay, when qi more than blood, cause miscarriage. When blood more than qi, it keep the baby well. Does it make sense to you? This is according to Phua Ltd. Right, that's it. This is the moxibustion and acupressure point for today. I better go because I have a patient in 20 minutes, so I had to tidy up and then go out and drive for about 5 minutes into my clinic and for my patient. Okay, if you have any question, put it down there. Now, if you're a patient of ours, you're welcome to, come to our clinic and ask for this. We sell this in our clinic, okay? And anyone can get it, or you can call and email us and then pay online, and we will send you over and charge for the courier fee as well. Right, stay awesome, and I love you all. I'll see you tomorrow. So this topic is about acupressure point and moxibustion for infertility treatment. Now, if you're one of our patients or someone need infertility treatment, can either call us or give our details to us or share this video with them so they can do something for themselves. Stay awesome. I love you all. Bye bye.